This is Sabha Diary and you are watching my channel Learn with Sabha Diary. I welcome you all at my channel. Hope you are fit and fine, safe and secure. If you are new here, please subscribe my channel and like this video. Today my topic is capillary exchange, capillaries, fluid exchange and microcirculation in capillaries. Capillary exchange, movement of fluid and solutes across capillary walls such as water, ions, nutrients, waves, gases. Ions is sodium chloride, nutrients glucose, fatty acids, gases like oxygen, carbon dioxide, between blood and interstitial fluid. Movement of material across capillary walls by diffusion, filtration and reabsorption. Filtration, fluids and solutes are driven across the porous membranes, driven by hydrostatic pressure. What is hydrostatic pressure? Means physical force of a liquid against the surface is called hydrostatic pressure. And diffusion, movement of substance into higher concentration towards the lower concentration. And reabsorption. Reabsorption is the opposite of filtration. Reabsorption, movement of fluid and solutes back into the blood. Capillaries, tiny thin violet vessels carry blood close to all body cells and its tissues and organs. Only one cell thick and has a very small lumen where gas exchange takes place. Oxygen passes through the capillary wall and into the tissue. Carbon dioxide passes from the tissue into the blood. Here you see the diagram of capillary. Fluid input from the arterial side and output from the venule side. And capillaries contain a simple squamous epithelial cells, endothelial cells. For example, 10% fluids input in the arterial side, but output is only 9% by the venule side. So question arises here, where is the 1% fluid? So 1% fluid remain still in capillaries. Then this 1% fluid we consider the lymph, and then this lymph drained by the lymphatic system. Classification of capillaries on the basis of morphology. There are three types of capillaries: continuous capillaries, fenestrated capillaries and sinosidal capillaries or discontinuous capillaries. Continuous capillaries, as their name suggests, continuous capillaries have no continuous endothelial lining. These capillaries no perforation and allow only small molecules to pass through. They are present in muscle, skin, fat and nerve tissues. Fenestrated capillaries contain a small cytoplasmic gap and lie on a uninterrupted basal lamina. Sinosidal capillaries are slightly larger than fenestrated capillaries. Sinosidal capillaries have a larger gap between endothelial cells. They are found in the adrenal gland, liver and spleen and bone marrow. Okay. The formation of interstitial fluid and transcapillaries. by capillary wall, hydrostatic pressure in capillary, and interstitium, protein concentration in the blood, and interstitium. Basic principles for such transport originate from fundamental work by Starling more than a century ago and are still applied. Four of the main forces which determine the fluid flow direction between interstitium and capillaries. Number 1, the blood hydrostatic pressure. The blood hydrostatic pressure that promotes the filtration within vessels. The hydrostatic pressure is due to the pressure that water in blood plasma and exerts against blood vessel walls. The hydrostatic pressure in the intravascular space is the principal force driving water and electrolytes out of the capillaries into interstitial space. Blood hydrostatic pressure may vary in different tissues and at different level within each capillary bed. The normal hydrostatic pressure in the capillary bed is controlled by local myogenic, neurogenic, and humoral modulation of the arterial and venous resistance. Number 2, interstitial fluid hydrostatic pressure. Interstitial fluid hydrostatic pressure that promotes the reabsorption as well as filtration. The opposing pressure of the interstitial fluid, called interstitial fluid hydrostatic pressure, in encapsulated organs such as the kidney, normal interstitial pressure are positive, while in most of loose tissues like subcutaneous layer in skin, this is subatmospheric. Besides the mechanical and electrostatic properties of the tissue, the continuous pumping of the lymph vessels also play an important role in determination of interstitial fluid hydrostatic pressure. Number 3, blood colied osmotic pressure is a force caused by colloidal suspension of these large proteins in plasma. This effect of blood colied osmotic pressure is to pull fluid from interstitial space into capillaries. Albumin is the primary plasma protein that is responsible for approximately 80% of the total blood colied osmotic pressure. Number 4, interstitial fluid osmotic pressure that promotes the filtration, pull fluid out of capillaries into the interstitial fluid. The interstitial fluid osmotic pressure is generated from smaller size proteins and the minimal amount of albumin. So these four types of forces which determine the fluid flow direction between interstitium and capillaries. Here is the sum up of four forces: blood hydrostatic pressure and interstitial fluid osmotic pressure promotes the filtration, and blood colied osmotic pressure and interstitial fluid hydrostatic pressure promotes. If you have any confusion related to this topic, feel free and drop your question below the comment section. I will answering you as soon as possible.